$9 million was taken back to mitigate the COVID threat by the government, so that ultimately only $5.22 million was reserved for project management. Because this money is disbursed by the hard work of all the health workers, the PDs, the RDs and the MOICs of small institutions, and in some institutions this money was disbursed.
On this, so if wants to add anything, I think it would be good.
At that time, Dr. Silla was the DDG MS2. So with the long-held idea of Dr. Silva, because all primary care is under his purview.
That was developed by our own people. So this is why I think the project is moving. We are dealing with the Western province, but all the other provincial directors are also know very
shows that how the population is entangled, and there are 75,000, 62,000 and 43,000 people.
And what we are hoping to do for the next 2 years. So as the provincial director said, the Colombo is the area extent is 699 kilometers. It's the smallest district in the country.
We have planned several set of others, and finally in the 2022, the other set of hospitals.
Regional Directors of Health Services, colleagues, doctors, ladies and gentlemen. At the outset, I must mention that I am very happy to be back at the Ministry of Health on familiar grounds. Although I am the State Minister responsible for primary healthcare, epidemiology and COVID management, I consider it as an opportunity given to me to serve the people of our country with my experience, in the Ministry of Health. And listening to you, there are a lot of valuable comments that discussed, and thank you very much. And I also take this opportunity to thank each one of you for your excellent services, your commitment towards the control of COVID epidemic. I think especially Western Province, I think our PD and the 3 RDs deserve a big thank you for your hard work. Because Western Province was badly hit by the second epidemic, but you managed to control it. And despite all these activities, you also have contributed towards strengthening the primary healthcare project. So thank you very much for all your hard work. So this meeting was mainly aimed at identifying the problems you have, so that as a ministry we could intervene and support you. As Dr. Amal very correctly said, only Amal and I are in the ministry right now, and after 1 month we have got a place to run as an office. However, with your support, we'll be able to, strengthen primary health care. And as Amal mentioned, His Excellency Gotabaya Rajapaksa is very committed towards improving the health of the rural communities. It is in the government manifesto, and 2021 budget also has identified funds to strengthen rural health services. So this World Bank project will complement the government's vision to provide quality healthcare to the rural communities. And as mentioned, primary healthcare is the backbone of our health system. And although the public health system has a very defined program, very defined populations, but the curative sector, I am very happy to note that this empanelment introduced through the strengthening project has identified clear, the people, each hospital has been given a designated area and a population. Of course, the population varies depending on the the densities of the area. So this is a very good this will give us a clear idea as to where we should strengthen our services. Of course, it may differ from district to district how we are going to reduce the population and also reach out to the people. Right now we have been seeing the secondary and tertiary hospitals, they are overcrowded. and as a result, the quality of services, cannot be, quality has gone down, and there are a lot of among the people also, the perception and also the people's satisfaction is also at stake. But with this strengthening, when the primary healthcare units are strengthened and the people have a place closer to their homes, I think they will also seek treatment, seek care, and also these units can be utilized to promote health, prevent diseases, and also to identify the risk factors early. And I think Dr. DDG Champika also mentioned that it's not only hypertension, when cancers could be seen. I think although this project focuses on non-communicable diseases, we have to aim at total family care from birth until death. Because again, I know non-communicable is cross-cutting, but again, our elderly population also will double in by 2025. And then we also have community mental health programs where patients may need medication at their homes rather than taking them to hospitals for admissions and treatment. So this has to expand, and also as mentioned by a lot of experts here, we have to strengthen supervision, monitoring, follow-up, and also this, although the project ends by 2023, this has to be this has to get incorporated into our ongoing health plans, maybe central and provincial level. So this cannot, just because the World Bank project ends, this cannot stop with the end of the World Bank project, but it should be an ongoing activity. I will instruct Dr. Amar Harsha, my secretary, to look into the human resource issues, because most of these PMC primary care units were managed by RMOs and AMOs in the past, but now it's a dying service. But we have to get MBBS doctors, because we are producing enough doctors, and we have to give priority to these PMC, primary health care units, because His Excellency has mentioned several times, even today he mentioned about the need to provide doctors, at least 2 per unit, but depending on the population, the cadres may vary. And also he proposed recruiting a nursing officer, but of course it cannot be a nursing officer, but to introduce a cadre like the public health midwife who can visit homes, but not for MCH, because MCH is covered by public health midwife, but to identify another cadre who can visit homes, identify the high-risk groups, and so that they can be brought for services. I think it is a very good idea if we are to focus on reducing NCDs, because it is the highest cause of mortality and morbidity in this country. So maybe with 1 year's training, so that we have to work out whom we are going to recruit, what the training, their job description, etc. But of course, it should not duplicate somebody else's, otherwise, it will be a waste of resources. And again, you highlighted about the reimbursement of funds for reagents. So we look into the possibility how we are going to sort it out, because that is again a cross-cutting problem which I observed in all 3 districts. So with that, we will be able to sort of improve the public perceptions, improve the quality of care by strengthening primary health care units. And we also have some specialized doctors who are specialized in family medicine, who also we have to sit and work out as to how we are going to link them also into this existing structure, because they also work at the primary health care levels. So with that, we will be able to provide quality services to the people, especially in the rural communities, because those in urban areas, they have access to services, but the rural population, they do not have access to quality services. So with this project, by strengthening primary health care, we will be reaching out to the rural communities, and also we can create an enabling environment in which they can get their services. And while they get services, they also will be able to access information about relevant messages. Because as a politician, what I observe is the people with non-communicable diseases, they come for treatment when once they don't have any signs, they stop treatment, they discontinue treatment, right? Because we go for funeral, about 3 to 4 funeral houses, and when I ask the causes of death, they say I had hypertension, I took treatment, I was okay, and then discontinued. It's the same for diabetes. So the patient's awareness on the need to take treatment continuously is not there, because this happens when they go to secondary, tertiary care hospitals. The staff, they do not have time because of the overcrowding. They do not get quality services. So with the strength, if the PMCs are strengthened, the patients will be able to get quality, services. So as a result, psychologically also they would benefit. So with that in mind, let me wish all of